What is perinatal depression and perinatal mental health? Perinatal mental health refers to mental health during pregnancy and postpartum period. Sometimes it also includes the preconception period. And in terms of postpartum, people actually think that postpartum period mental health conditions can affect individuals up to a year postpartum. New research even indicates that some of these effects are lasting 1 to 2 or even more years after the birth of a child. What conditions can occur during pregnancy and the postpartum period? We know with a lot of decades of research that huge changes are happening at the biological level in your body. Hormonal changes occur during pregnancy and postpartum. We also know that psychologically and socially, there are many stressors that occur during this period. These stressors and changes can really predispose individuals to have multiple conditions that can develop and put them at risk. If you have a history of having prior mental health conditions or symptoms, this actually increases your risk as well of developing depression, anxiety, and other mental health conditions during the pregnancy and the postpartum period. There are many conditions that can occur during this period. The one that is better known is postpartum depression. However, depression symptoms can occur not only during the postpartum period, but also during pregnancy. Very often, depression symptoms can also have co-occurring anxiety symptoms. We also know that obsessive compulsive disorder symptoms can also occur, as well as bipolar disorder and postpartum psychosis. You may be wondering, how do I know if I have postpartum depression? Similar to other times when people can develop depression, one of the main symptoms that people develop is actually depressed mood. However, it can also look like irritability for some individuals. People may also feel like they do not want to do activities or enjoy activities that they used to. They may isolate and feel like withdrawing from family and friends. They may have difficulty bonding with their baby and feel detached from their baby. They also may be crying a lot and may have difficulties with sleep, as well as feeling very tired and having less appetite. Of course, what we need to make sure that we review with a doctor is that there are appetite changes and sleep changes that occur during pregnancy and postpartum. So it's important to determine whether some of these symptoms are related to changes that occur during pregnancy and postpartum, or if these are associated more with depression. A common condition that can occur for people is baby blues. You may have heard of it. So baby blues are quite common, and they happen in the first 2 weeks after people give birth. With all the changes that occur during birth and also hormonal changes, people may start feeling like their mood fluctuates a lot. They may feel like they're crying and they don't understand why they are crying. However, if these symptoms persist and stay longer than 2 weeks, then we begin to be concerned about postpartum depression. Up to 85-90% of individuals who give birth experience baby blues. However, the severity and also the length of the symptoms is what really characterizes and distinguishes postpartum depression from baby blues. Fathers and non-birthing parents develop postpartum depression? Yes, absolutely. Over the past decade or so, we're having more and more research that is pointing to non-birthing parents and fathers developing postpartum depression. we're also beginning to understand how the risk of other mental health conditions also increases for non-birthing parents and fathers. Up to 10% of fathers can experience postpartum depression symptoms, and so it's very important to get help. What we know is that if a birthing individual has postpartum depression or other mental health conditions, that increases the risk of non-birthing parents to have postpartum depression. We also know that if your partner has postpartum depression, whether that be the birthing or non-birthing parent, that can affect the whole family system and can increase the risk of the other partner developing depressive symptoms.